Hey, Tim Frisch with A Frisch Perspective here. I wanted to show you an article that shows a study that's been creating a little bit of a buzz recently. And it really relates to what I've been talking about on this channel with churches that are choosing to continue to have services during the pandemic. And a lot of these churches I've been highlighting are actually having indoor services, even though there are government restrictions in their area, such as John MacArthur at Grace Community Church in Los Angeles, Pastor Rob McCoy of Godspeak Calvary Chapel, also out in California. But this study that I'm going to show you is really interesting, and I plan to talk about it later this week with Jason Whitaker, who's planning to join me again for a conversation. So I look forward to that, and this is one of the topics we plan to cover. It says here, Americans' mental health ratings sink to new low. But that's not really the whole story, so I just want to show you something really interesting here, but I'm going to read part of this article. It says, Americans' latest assessment of their mental health is worse than it has been at any point in the last 2 decades. 76% of U.S. adults rate their mental health positively, representing a 9-point decline from 2019. So this is from Gallup polls, and this study is really a self-assessment, it sounds like, that people are doing, how they rate their own mental and physical health. And what it sounds like here is that there has been a 9-point decline in people's mental health since last year, 2019. So this chart here shows you from 2001 to 2020 Americans' assessment of their mental health. And you can see here in the last year there has definitely been quite a decline. In answer to these questions, how would you describe your own mental health or emotional well-being at this time? Would you say it is excellent, good, only fair, or poor? Later in the article, it says Democrats and frequent church attendees show the least change in their mental health ratings. The subgroups showing the greatest declines in excellent mental health are not necessarily the groups with the lowest positive ratings. That is, more Republicans and independents than Democrats say their mental health is excellent, while women rate theirs less positively than men. In addition to women and Democrats, lower-income Americans, young adults, the unmarried, and those who seldom or never attend religious services have the lowest excellent ratings. These demographic patterns have been mostly consistent over the past 20 years. Now, this chart that I'm about to show you is what I've been seeing online some, and where it gets really interesting with the conversation that we've been having on this channel. It says here, Americans' rating of their mental health as excellent by demographic groups 2019 versus 2020. And if you look at this and pay attention here to the differences in all of these groups, you'll notice that there is one group where the mental health has actually gone up in points, and that is those who attend religious services weekly. It's gone up 4 points. Everybody else's mental health is actually rated lower. Now, that's a self-assessment, but what it's showing here is that people's self-perception of their mental health is generally lower, and in some cases much lower than it was a year ago. But there's one exception to that, and that is with people who attend religious services weekly. Now, that's not to say that everybody who goes to church feels better than they did a year ago, but it does say that overall, if there's one exception to the decline in mental health, it's those who are attending religious services every week. So the article ends this way. Bottom line, more than 8 months into the coronavirus pandemic in the U.S., Americans' reports of mental health are much worse than a year ago. While they remain more likely to say their mental health is excellent than their physical health, the gap between the two has narrowed this year. So I think what this article is showing overall is really something that needs to be added to the conversation as we talk about church. And I know that there are a lot of factors we have to take into account, and I know some of you have voiced very strongly your concerns or even opposition to people like John MacArthur, Grace Community Church, continuing to meet indoors. I understand the concerns there, but at the same time, there's a bigger picture that we have to continue to look at. It's not just people's physical health and the spread of the coronavirus, it's also people's mental health and the health risks that are there if we don't allow people to meet. And I think what this study shows is that, surprise, surprise, when people get together in social settings, when they're around people that care about them, when they go to church and they have that experience of being at church, it has a positive effect on their mental health. And that's in the midst of a year where things have been pretty tough. And what I would say to that is that when things are hard, but you go through it with other people, it actually makes you a stronger person. And I think there's some evidence of that in what we're seeing here in this study. Now, I'm sure there's going to be varying opinions on this in the comments below, and I certainly would like to hear what you have to say about this. But I do think that this piece needs to be added to the conversation, that even though we want to take certain precautions and we want to be wise about how we handle the COVID-19 situation, this study reminds us that getting together with other people and actually experiencing those in-person services on a weekly basis here, for these people who do so every week, it's actually had very positive outcomes on their mental health. And they are the only group that has actually increased in their mental health in this past year. So I thought that was really interesting. I'm not saying that this is the only information we need to take into account, but it certainly is a piece of information we ought to take into account as we think about all of this. So let me know what you think in the comments below. I wanted to share this information and some of my thoughts. Thank you so much for listening to what I have to say from A Frisch Perspective.